Hi, I'm Danielle Burkett, and I'm an OBGYN at Bibby Women's Healthcare. I'm so excited to be joining you for this year's virtual Bloom event. Thanks for joining me. Today, we're going to talk about hints for a successful and healthy pregnancy. At Bibby Women's Health, we are patients too, and we are here to help guide you through your pregnancy journey. Hopefully, today's hints will give you some ideas of ways that you can achieve a healthy, successful pregnancy. The first thing that I always tell people is that it's good to plan ahead. If you're planning to become pregnant, there are some things that you can do to plan for a successful pregnancy before you actually do conceive. The first, prenatal vitamins. I recommend that all of my patients who are of reproductive age who have any potential of becoming pregnant be taking a multivitamin with folic acid. Folic acid helps prevent birth defects of the spine and the brain that can be incompatible with life and can be very devastating. So having that prenatal vitamin with folic acid on hand prior to pregnancy is incredibly important. And if you're not taking one now, you can go ahead and start. Second is pregnancy timing. It's great if we can actually plan for pregnancy when we're ready for it. Now, this isn't always possible. We know that some pregnancies are unexpected, and about 50% of pregnancies are actually unplanned. However, if we are able to control the timing of our pregnancies, then we can actually optimize our health prior to conceiving and make sure that we're emotionally, financially, and physically prepared for pregnancy. This may mean abstinence, it may mean natural family planning, or birth control options that you can review with your primary care or OBGYN provider so that you can plan your pregnancies for when you're ready. Another thing to consider is inter-pregnancy intervals. So there is evidence that pregnancies that are too close together can actually have poorer outcomes, and there is an optimal time to wait prior to conceiving. Again, after a miscarriage, we usually recommend waiting at least one menstrual cycle, but between deliveries, there's some evidence that waiting approximately 2 years may be better for the overall health of the pregnancy. If you've had C-sections in the past, that interval between pregnancy is important for the healing of the uterus after surgery. And then another thing to consider is your overall health. It's important that you optimize your health prior to trying to conceive. If you're overweight, this may mean losing some weight so that you're an ideal body weight prior to getting pregnant. If you have chronic medical conditions like diabetes or hypertension, getting those conditions under control prior to pregnancy is incredibly important. Next, prenatal care. Prenatal care contributes to healthier pregnancies overall. And it's important that you start your prenatal care early and continue your prenatal care throughout the pregnancy. For most women, prenatal care is going to start somewhere between 8 and 12 weeks, depending on the practice and when you discover that you're pregnant. For some women, they need to be seen earlier. Certain high-risk conditions like a previous ectopic or previous pregnancy loss may mean that you need to see your provider earlier. Likewise, if you're having complications early in pregnancy like bleeding, pain, or vomiting that is intractable and is causing you to lose weight or isn't allowing you to keep down fluids, these are things that may require you to be seen prior to the standard time of the first prenatal visit. It's important that you also keep all of your prenatal visits. Generally, women are seen approximately every month during the first 2 trimesters of pregnancy, and then usually every 2 weeks from 28 to about 35 or 36 weeks, and then weekly during the last month of pregnancy. Sometimes women will need to be seen more frequently if there are complications of the pregnancy. Likewise, if your provider refers you to a specialist, it's important that you keep those appointments as well so that we can make sure that we're taking excellent care of you and that baby. The next thing that's important when you do have that visit with your provider is to share your history. We want to make sure we get a very thorough history because it's important that we have all of the information about your health so that we can take care of this pregnancy in the best way possible. First, you want to make sure you're reviewing existing medical conditions. These include things like high blood pressure, diabetes, autoimmune diseases like arthritis or lupus. If you have asthma or respiratory problems, these are all things we want to know. We also want to know if you have any history of any mental health disorders like depression or anxiety. These things can be exacerbated by pregnancy, and if we know ahead of time, we can help you through these. Next, surgeries. We want to know if you've had any surgeries in the past. This is important because some surgeries can actually impact your pregnancy. For example, cesarean sections in previous pregnancies are important to know about because they impact the type of delivery planning that we need to do. Some people with previous C-sections may be able to go on and have a vaginal delivery or a VBAC, whereas other types of cesarean sections or certain numbers of cesarean sections may prevent you from having a vaginal delivery. Likewise, heart surgeries or other abdominal surgeries may pose complications in pregnancy and are things your provider should be aware of. It's important that you go over all of your medications with your doctor. Prescription medications, of course, are something that you should review with your doctor because there are some medications that aren't safe in pregnancy and may need to be switched in early pregnancy once you know that you're actually pregnant. But we also want to know about over-the-counter medications. Just because something is available over the counter doesn't mean that it's necessarily safe in pregnancy. So if you have questions about what medications are safe, you should definitely ask your doctor. Our practice provides a pamphlet that we give to all of our OB patients that has a list of acceptable over-the-counter medications. But if you have any questions, you should always call us so that we can make sure that you're not taking anything that could pose a risk to your baby. But supplements are also important for us to know about because not all supplements are safe in pregnancy. And then finally, we want to know about any previous pregnancy complications because these can have significant impact on the health of your pregnancy as well. Things we would want to know about are if you've had previous miscarriages, if you've had ectopic pregnancies where the pregnancy is outside of the uterus. As we mentioned, pre-existing diabetes or high blood pressure, but also gestational diabetes or blood pressure associated with pregnancy, preeclampsia or eclampsia, if you've had cholestasis in pregnancy, also complications of the delivery itself. If you had an operative delivery, either a vacuum or forceps delivery, if you had a tear into your rectum during delivery, if the baby's shoulders got stuck, if you had a C-section, and for what reason. These are all things that we want to know about. Or if you had a postpartum hemorrhage, having previous complications in pregnancy has an impact on this pregnancy as well. And we want to be prepared so that we can minimize your risk. Next, watch what you put in your body. Your body is your temple, especially when you're housing a little one. So you want to make sure that you're putting the right things in and avoiding the things that you don't want in. So things that we do want you to do, we want to make sure that you stay hydrated. Drinking plenty of water is incredibly important during pregnancy. It decreases the risk of urinary tract infections, which can be riskier in pregnancy. It also can help prevent preterm contractions. And we just want you to make sure that you're drinking plenty of water. You want to eat a healthy, balanced diet. You want to eat lots of protein and fruits and vegetables, healthy fats, whole grains. You want to take a prenatal vitamin with folic acid, as we've discussed. And you want to make sure that there is iron in your prenatal vitamin as well. Some prenatal vitamins, especially gummy vitamins, don't have iron in them. And so it's important that you make sure that you review the type of prenatal you're taking with your provider. If your doctor has prescribed you medications, you want to make sure that you're taking those as prescribed as well, because not doing so could pose risks to your pregnancy. And then ask your doctor about any over-the-counter medications that you take before you take it, so we make sure that you're taking something that's safe. What we don't want you to do, smoking, drinking, and recreational drugs are things that we definitely want to avoid. We know that smoking increases the risk of placental abruption in babies that are small. Alcohol There is no known safe amount of alcohol in pregnancy, and it can contribute to fetal alcohol syndrome and also behavioral and developmental problems in infants after delivery. And then recreational drugs, even things like marijuana, which some people seem to think are benign, can cause complications in pregnancy with the baby's growth and brain development. You don't want to drink excess caffeine. Some caffeine is okay, but large amounts of caffeine can cause complications. You don't want to assume that everything that's herbal or natural is safe. The truth is that there are plenty of herbs and natural remedies that can pose complications and risks to your baby. So make sure that you're reviewing those with your provider. And then there are certain foods that you should avoid during pregnancy. Certain fish are very high in mercury and should be avoided. These include shark, swordfish, tilefish, and king mackerel. Canned tuna can have higher mercury rates, and so you want to avoid excess amounts of canned tuna. Unpasteurized cheeses, deli meats, and raw or undercooked meats are also things that you need to be careful with. Deli meat can be consumed, it just needs to be heated till steaming to kill any potential bacteria. Next, keep on moving. We want you to exercise. There are a lot of benefits to exercise in pregnancy. A publication of the American College of Obstetrics and Gynecology quotes these benefits of exercising regularly in pregnancy. So higher rates of vaginal deliveries in women who exercise regularly, and we know that vaginal deliveries are safer for women and babies, and women recover more quickly from them. So that's one benefit. There's also lower rates of excess weight gain in moms who exercise regularly, lower rates of diabetes or hypertensive disorders, less preterm birth, lower cesarean sections, and lower incidence of low birth weight in babies. Additionally, exercise during pregnancy is really good for your mental health. Everybody knows that pregnancy can be a little bit of an emotional time, and exercising regularly helps prevent depression and anxiety in pregnant moms as well. So along those lines, it's important that you watch your weight during pregnancy. Recommended weight gain during pregnancy is based on your pre-pregnancy weight, or the weight of when you conceived. So women who are normal weight, it's recommended that they gain 25 to 35 pounds. If you're overweight, which means a BMI between 25 and 29, then that's recommended to, you're recommended to gain 15 to 25 pounds. And for women who have a body mass of 30 or over at the beginning of pregnancy, the recommended weight gain is 11 to 20 pounds. So there are a lot of complications that can go along with excess weight gain during pregnancy, and that's why it's important to gain the recommended amount of weight. For moms, there's higher risk of diabetes, high blood pressure, preeclampsia. There's increased risk of large babies, and large babies can lead to higher order maternal tears, so tears that go into the rectum and can lead to incontinence and pain after delivery. Shoulder dystocias, where the baby's shoulder gets stuck during delivery, which is very dangerous for the baby. Postpartum hemorrhage is higher in big babies, increased risk of cesarean sections, and also increased risk of ICU admissions for low blood sugar in babies who are large. Number 7, visit the dentist. This one may seem a little bit odd, but there is actually evidence that poor oral hygiene can be associated with poorer pregnancy outcomes. So pregnant women are at an increased risk of cavities and gum disease, but also oral disease during pregnancy can increase your risk of preterm birth and lower birth weights. So go ahead and schedule an appointment with your dentist. If you or your dentist have questions about procedures that are safe during pregnancy, this is something you can review with your OB provider. In our practice, we have a letter that we provide for dentists so that they know what is and what is not allowed during pregnancy to make sure we're keeping mom and baby safe. Next, educate yourself. It's important that you do some research and try and find out what you need to know about pregnancy and delivery and taking care of that baby once you get home. So Do reading, but make sure that you're looking at reliable resources. There's a lot of misinformation out there. You want to be careful of things that you find on social media. They may not come from trustworthy sources. Some places that you can look for some reliable information, you can check out the Center for Disease Control's website. The American College of Obstetrics and Gynecology has information for patients. Womenshealth.gov is a great resource. What to Expect, which is from the original What to Expect When You're Expecting book, and now has grown into a number of books and websites that has a lot of good information that can help you know what's normal during pregnancy and give you some information that can be useful. There's also an organization called Mother to Baby, which is a service of the nonprofit organization of teratology information specialists, and that is an organization that provides information about medication exposures during pregnancy and what is safe. So that's somewhere you can look for information about both in pregnancy and lactation, what the effects of potential medications might be. Ask your doctor questions. I know a lot of patients have pregnancy brain and it's hard to remember when you're sitting in front of your doctor what exactly you wanted to ask. So take notes, write them down, bring them with you, bring somebody with you if you can that can help you remember what your questions are so that we can go over the information that you feel you need to know to take care of yourself and your baby in the best way possible. Take a class. There are a lot of classes that can be really helpful both for pregnancy itself and for dealing with delivery and postpartum. Some good class options are classes that specifically guide you through the childbirth process. Other classes are available for breastfeeding, which can be very helpful to have before baby shows up. There are classes on caring for your newborn, and also infant and child CPR are good options for things that you can learn about while you're waiting for baby. And then we recommend touring your birthing facility if possible. This just will alleviate some anxiety about what to expect. Just knowing where you're going, where you're supposed to show up, what it looks like, can just put your mind at ease and help you feel prepared for the big day. So next, it's important to know when to call. So there are some things in pregnancy that are just normal and not to be worried about, maybe a little bit bothersome, but aren't dangerous. And it's sometimes hard to know when to call and when not to call. In our practice, we provide a list of reasons that you might want to call, but some of the things that we definitely want to know about: if you're having bleeding more than just a little spotting after exam, if you're having persistent or severe pain, if you're having headaches, especially if associated with vision changes, if your baby's not moving well after you get past the 22 to 24 week mark, that can be a sign of something going on. If you're having regular contractions prior to being full term, or if you're leaking fluid, these are things that we definitely need to know. You want to make sure that you have the number for your doctor's office on hand so that when you do have a reason to call, you know who to call. And also know where you're supposed to go in the case of an emergency. It's generally recommended that you go to the hospital where your provider is practicing so that they can have access to you and your records if you need to be admitted. I generally recommend to my patients that they avoid freestanding ERs because they often don't have people staffing their facilities that are knowledgeable in obstetrics, and they often don't have the resources to deal with any obstetric emergencies. So a lot of times if you show up there and something's really wrong, they're just going to have to transfer you to another facility. So skip that step. If you're not sure where to go, call your doctor's office, and there's usually an on-call person who can help you know where the best place is for you to go for evaluation. So my next recommendation, and maybe one of the most important, is to roll with the punches. Pregnancy is quite an adventure and quite a journey, and we all, when we get pregnant, have expectations and dreams and ideas about how the pregnancy will proceed. And sometimes things don't go exactly as planned. And it's important to be able to be flexible and to make changes in the plans when necessary. I do think that it's very important to make a plan with your provider. I think that it's an important exercise to go through what normal pregnancy looks like, what a normal delivery looks like, and review with your provider your expectations and your wishes for your delivery and your pregnancy. But I think it's also really important to know that the goal at the end is for mom and baby to be healthy. And sometimes that means that we have to change our plans midway. And we're here to guide you through that. It can be scary at times and overwhelming. And it's important that you establish a relationship with your provider so that you feel like you can trust that they're going to guide you through it, because your health and the health of your baby are of the utmost importance to us. And our goal in the end is for you to go home with a healthy baby. So I hope that some of these pearls have been helpful for you, and I hope that you have enjoyed this time with me. I certainly have enjoyed this opportunity to talk to you about our recommendations, and I look forward to having the opportunity to possibly meet some of you and walk this journey with you. So thank you so much for spending this time with me. Again, I'm Dr. Danielle Burkett, and I'm with Vivi Women's Health. We are definitely accepting new patients, and so if we can help you, we hope you'll give us a call. You can find out more about our practice at www.vivifw.com. You can find us on Instagram and Facebook at Vivi Women's Health FW, or you can give us a call at 817-502-VIVI. That's 817-502-8484. Thank you so much for being with us tonight. I really appreciate you taking the time to spend this time with me, and I hope that you found this helpful, and I hope you enjoy the rest of the Bloom event. Good luck with your baby, good luck with your pregnancy, and I hope that it's all you dreamed it would be. Thank you so much.